Good morning. We all have our favorite patients, right? And when we see them on our schedule, we smile. It's not working. There we go. This is my favorite patient, Evelyn. And I'll never forget that day when she looked at me with tears in her eyes. And she said, "I just want to be able to smile." Evelyn had come in for her hygiene appointment with me and shared she was going to a friend's wedding in a few days. She said, "Susan, I want to go to this wedding and have fun and laugh out loud and take pictures. I just want to be able to smile without the constant fear that somebody will see what my teeth look like." And she covered up her mouth. You see, Evelyn is an HPV oropharyngeal cancer survivor, and this cancer devastated her mouth, her teeth, and her beautiful smile. At that point, I'd been a practicing hygienist for 16 years, and I was doing all I knew to help her manage the oral side effects of this cancer. But what I didn't know until that moment was how this cancer had affected her entire life. And what she said gave me a sick feeling in the pit of my stomach. And why? While Evelyn was going to a wedding, I was headed to my own big event in a few days. And what was my one concern? Were my teeth white enough? White enough, right? Downright silly compared to Evelyn's concern. Well, Evelyn was heavy on my heart that weekend as I jetted off to Las Vegas, baby. And it was the event of a lifetime for me because I was going to get to meet the one and only Donnie Osmond at his fan club get-together. You see, for me, as a teenager growing up in the 70s, Donnie was my dream. I was in love with Donnie. And that weekend, I did meet Donnie. Had my picture taken with him, was called up on stage with him. I worked out with him and his trainer. We even had dinner by candlelight. Okay, that one, the last one, it was a Las Vegas buffet with about 300 other fans in the room, but I was sure that Donnie and I had connected. But more important than that weekend, Donnie encouraged us to find a way to make a difference in our communities. And with Evelyn never far from my heart, on that flight home, I made a decision that changed my life and my dental hygiene career. I returned home with a profound sense of purpose and a passion to raise awareness about HPV, oral and oropharyngeal cancer, and this life-saving exam that we as dental professionals do every single patient, every single time, or at least we should. You see, there was a point in my career when I was not as thorough and consistent with this exam. So I made the decision to change so I could save lives and avoid tragedy. This reminds me of the blockbuster movie Titanic, because I envisioned Evelyn with this big smile on her face, a smile as big as Rose as she stood on the railing of Titanic with Jack before tragedy struck. You see, Titanic was billed as unsinkable, and the captain, he was unconcerned about the many messages of heavy ice in their path. And the radio operator, Jack Phillips, he was too busy transcribing the radio messages for the passengers to heed the many warnings, even responding to one message with "Shut up, I'm busy." Too busy? and unconcerned, really. And as a result of their unwillingness to adjust their course, epic tragedy occurred. Over 1,500 people lost their lives on Titanic. Another epic tragedy occurs every hour of every day in the United States when one person dies from oral or oropharyngeal cancer. And we have known since 1984 that HPV is an etiological factor in oropharyngeal cancer. Last year alone, over 53,000 Americans were diagnosed with oral and oropharyngeal cancer, and in 5 years, only a little more than half will be alive. One person every hour of every day in the United States dies from oral or oropharyngeal cancer. Our colleagues at the ADA House of Delegates sent us a clear message this past September when they amended their position on the early detection and prevention of oral cancer to now include oropharyngeal cancer, saying that a visual and tactile exam should be performed on every patient for oral and oropharyngeal cancer. So I ask you, did you get that memo? Will you now perform an oropharyngeal cancer exam along with your oral cancer exam? And do you know the difference, how that oropharyngeal cancer exam differs from the oral cancer exam? Well, today, I invite you to implement from my Cotten Method of screening and assessment 3 adjustments that you can make immediately into your practice for this oropharyngeal cancer exam. And the first, it's that visual and tactile exam of the oropharynx. And that includes the posterior base of the tongue and the lingual tonsils, the back of the throat, and the soft palate. Assessing those palatine tonsils for asymmetry in size and color. Assessing a patient's Mallampati score and palpating that glossotonsillar sulcus. And second is an updated health history, asking those pertinent questions that pertain to a patient's risk factors, genetic risk factors, and symptoms. And last is that thorough documentation of this exam into your treatment notes. 3 processes that you can make immediately into your practice for this oropharyngeal cancer exam to save lives. So I ask you, look at this smile. Evelyn was more fortunate than many. She was diagnosed early. She is a survivor, and she can once again smile with this dazzling smile of hers. And the Titanic, it did not sink because it wasn't well built or the captain wasn't an outstanding captain. It sank because they didn't have a process. What about your process in your office? Imagine the lives that you could save when you implement a process. Your entire team on this life-saving exam and assessment. It would be my honor, course, and my Cotten Method to your attendees, your event, your meeting. Together, we can save lives.